A visit to dentist. Toothache conversation. Hello, my name is Mrs. Wilson. Recently, I had a toothache, so I booked an appointment to see my dentist, Dr. Hollingsworth.
Hello, Mrs. Wilson.
Hello, Dr. Hollingworth.
What seems to be the problem, dear?
I have a terrible toothache.
I'm sorry to hear that. Let me take a look. Which tooth is bothering you?
It's the lower left molar. It's been hurting me for a week. I can't eat or drink anything cold or hot.
Let me take a look. Please recline and open your mouth. That's good. I can see a large cavity in your tooth. It looks like it has reached the nerve. That's why it's so painful.
Oh no, that sounds bad. What can you do for me?
Well, there are two options, dear. One is to do a root canal treatment, which means removing the infected nerve and filling the tooth with a special material. The other option is to extract the tooth and replace it with an implant or a bridge.
What is the difference between the two options?
A root canal treatment is a more conservative option that preserves your natural tooth. However, it may take more than one visit to complete and it may not be successful in some cases. An extraction is a more radical option that removes the source of infection, but it may cause some bone loss and affect the alignment of your other teeth. Both options have their pros and cons. And the decision is up to you, Mrs. Wilson.
I see. Which option do you recommend, doctor?
I recommend the root canal treatment, as it has a higher chance of saving your tooth and preventing further complications. However, you need to understand the risks and benefits of both options and give your informed consent before we proceed.
Thank you for explaining, Dr. Hollingsworth. I think I'll go with the root canal treatment. I hope it works.
You are welcome. First of all, let us take X-ray of the hurting tooth. Then, I am going to give you some local anesthetic to numb the tooth and the surrounding area. You may feel a slight pinch when I inject it. Are you ready?
Yes, I'm ready. Let's do this.
Here we go. Please wait 10 minutes at reception. I will call you back.
After 10 minutes.
Please, come in, Mrs. Wilson. Is your jaw numb now?
Yes, it is, doctor.
Good. Please relax and let me know if you feel any pain or discomfort. I'll use a drill to make a small hole in your tooth and then use some instruments to clean out the infected nerve. Then I'll fill the tooth with the rubber-like material called gutta-percha and seal it with a temporary filling. Later, you'll need to come back for a permanent filling or a crown to protect your tooth. Do you have any questions?
No. When is my second appointment?
After 1 week. Please follow my instructions and take care of your teeth. Don't forget to floss after eating, and to brush before and after bedtime to remove any plaque. It will make your teeth white and bright with a shiny smile. Also gargle regularly with minty mouthwash. It will give you a fresh breath. If you have any problems or concerns, come to the clinic.
Thank you, Dr. Hollingsworth.
Goodbye, Mrs. Wilson.
Goodbye.